Good morning. I'm Dr. Patricia Turner, Executive Director of the American College of Surgeons, and we represent some 84,000 surgeons of all specialties across the country and around the world. We are the largest professional organization of surgeons focused on the care of the surgical patient. Firearm violence is a growing public health crisis that must be immediately addressed. Absolutely no one believes that innocent children deserve to be gunned down in their classrooms. This is a public health crisis, not a political debate. And the American College of Surgeons is committed to crafting solutions that will save lives and minimize preventable death. We are unwilling to wait for another tragedy to befall another community when we believe we have a series of actions that can save lives today. I say parenthetically that when I wrote these comments yesterday, I was unaware that we would have yet another mass casualty event just last night in Tulsa, where several individuals were killed in, of all places, a doctor's office. It is surgeons who are on the front lines of these tragedies. We are the ones who see the effects of this crisis every day: homicides, suicides, those who are killed, and those who are grievously injured. We must be an integral part of this solution to reduce the rising number of deaths that we see every year. Shockingly, firearm deaths have now surpassed motor vehicle crashes as a leading killer of young people. Every one of these deaths occurs in one of our patients. Surgeons are data-driven, we are practical, we are problem solvers, and it's clear that to address the scourge of firearm violence, we need to bring everyone together from all sides of the ideologic spectrum to respectfully craft solutions that can be embraced in a bipartisan way so that we can move the needle and not have another death. For more than 3 decades, the American College of Surgeons has been on the forefront of these conversations. We have advocated for effective prevention of firearm injuries. We convened the FAST group, the Firearm Strategy Team, a group of highly regarded trauma surgeons and surgeons of all specialties to craft actionable solutions to solve this problem. Importantly, and essential to that work, is the fact that the FAST work group included both firearm owners and those who are not firearm owners. It is only by bringing together all sides of the ideologic spectrum that we can come up with effective and durable strategies for reducing firearm death and disability. The FAST work group published 13 recommendations in 2018 and present a path forward for us today. The recommendations are based on broad consensus from trauma surgeons, those best equipped to tell us what the strategy should be. These recommendations respect the right to own firearms while still charting a course to diminish firearm violence. Dr. Eileen Bolger, Medical Director for Trauma, will provide greater specificity about those recommendations in a few moments. More details will follow, but to put them into a number of key categories, they include background checks, registration and licensure, education and training, safe storage, red flag laws, mental health strategies, and enhanced research. All of these elements are part of a multifactorial approach to solve this problem. In 2019, we convened 44 national medical and injury prevention organizations for a multidisciplinary summit to address this massive health problem and to build on the decades of work that surgeons have implemented thus far. We identified a comprehensive public health and medical approach which include a number of the following elements. We must recognize firearm injury as a U.S. public health crisis and take a comprehensive public health approach to solving it. We must research this public health crisis and invest time and energy and resources into the efforts to do the research commensurate with the burden that the firearm injuries place on our society. We must empower the medical community across all healthcare settings, across all specialties, to figure out the best way to counsel patients on safe firearm storage, to screen patients at risk for firearm injury or death, and to engage the community as we solve the problems incorporating social determinants of health, which we know have a role as well. And finally, we commit to engaging the professional stakeholder organizations to ensure that these statements lead to constructive action as we move forward and improve the health and well-being of our nation. In 2019, we established the second task force known as the I-SAVE team, and that's improving social determinants to attenuate violence. This multidisciplinary team has also made concrete recommendations to address the underlying factors that contribute to the escalating violence that we see in our communities year over year. I've briefly outlined an approach, direction, action, and pathway to address this public health crisis, and we collectively must redouble our efforts and take action today, now. Today, I'm announcing that we will convene and co-host another of our multidisciplinary summits this fall to intervene in a meaningful way to diminish premature death and disability from firearms. The American College of Surgeons stands ready to work with and to help educate legislators at both the federal and state levels so that we can incorporate what we know in a data-driven and evidence-based way to impact across the spectrum and save lives. We'll continue to work with all healthcare workers, advocates, colleagues to create these solutions, and our future, indeed all of our futures, depend on our ability to find durable, actionable steps that we can implement tomorrow to save lives. And our proposals are embraced by both gun owners and non-gun owners alike, and we are unique in that regard. It's only by proposing these implementable solutions that we can prevent the next massacre. Next, I'd like to introduce Dr. Ronnie Stewart, Chair of the Department of Surgery at University Health in San Antonio, Texas, and a previous Chair of the Committee on Trauma, Medical Director for Trauma at the ACS. Dr. Stewart is a recognized leader in prevention and treatment of firearm violence, and Dr. Stewart and his team treated 4 of the victims of last week's shooting in Uvalde, and also previously the victims of the Sutherland Springs shooting. As a trauma surgeon, he will give you his firsthand reflections about treating these patients. Dr. Stewart.
Thank you, Dr. Turner. Thank you for your leadership, and thank you for the opportunity to participate today. Good morning. I'm Ronnie Stewart. Sadly, I'm here today as a trauma surgeon who has cared for the 2 of the largest mass shootings in modern U.S. history, the Sutherland Springs First Baptist Church and the Uvalde school shootings. These injuries inflicted by high-velocity weapons used at both of these attacks are horrific. A high-capacity magazine-fed semi-automatic rifle such as the AR-15 causes extremely destructive tissue wounds. These wounds are horribly lethal at close range. And sadly, most victims do not survive long enough to make it to a trauma center. Our team at University Health received 4 patients from the Uvalde shooting, and all of our current patients are improving, which really brings us joy in this dark time. But all of them have a long road to deal with recovery, with both the physical and emotional impact of their injuries. And unfortunately, this moment of crisis will have a lifetime of impact on these innocent souls. And our teams are working together to facilitate healing in a way that minimizes long-term impact and effect. I'm very proud and honored to work with the American College of Surgeons, and the ACS has worked tirelessly to establish regional organized trauma systems of care that make a real-life difference in our patients, in our communities all across the U.S. In many ways, South Texas has a model trauma system. It's modeled on the ACS system, and this system worked extremely well in both Sutherland Springs and Uvalde to coordinate and communicate the situation from the scene and improve the care of those patients. Using our trauma system in Uvalde, we were able to get whole blood directly to the scene, which appears to have made a real difference in at least one of our patients. As an action item from Sutherland Springs mass shooting, we increased Stop the Bleed education and training and advocated for state Stop the Bleed education training and partnered with Representative Barbara Gervin Hawkins on Texas House Bill 496, which implemented that training and equipment in Texas schools. So having a great trauma care system, implementing the ACS Stop the Bleed education program, and regional whole blood are all critically important programs that do make a real difference in our patients' lives, but they're not enough. They're not enough. Those are all mainly treatment things, and treatment is not enough. We have to effectively prevent these tragedies, and they are preventable. They are preventable. They're preventable by using the principles articulated by Dr. Turner. A key facet of the ACS trauma system approach is working together to serve the best interest of our patients and our communities. Working together to serve the best interest of our patients and communities. A trauma system encourages and enhances, hardwires cooperation and communication, because cooperation and communication save lives. But it hardwires that cooperation, communication, and partnerships even among competitors. Even among competitors, that is necessary. And the ACS approach centers around a common narrative with respect to firearm injury prevention that really facilitates working together. It facilitates working together. An inclusive narrative that goes something like this. Firearm ownership is a constitutionally protected liberty. It is. And we also, though, have, as Dr. Turner pointed out, an epidemic of violence and firearm-related injury, death, and disability in the United States. 2020 was the year that firearm-related injury became the #1 cause of death of U.S. children and adolescents. I'm not talking the #1 trauma-related cause. The #1 cause of death of U.S. children and adolescents is firearm-related injury in 2020. And the deaths are just the tip of the iceberg. The deaths are just the tip of the iceberg. So what can we do? Well, using the common narrative, we can address this epidemic of violence by continuing to work together to do two things. One, work to understand and address the root causes of violence. Work to understand and address the root causes of violence while simultaneously working together to make firearm ownership as safe as reasonably possible for those who own a firearm and for those who do not. We can prevent these atrocities by working together. And I'm going to say, and this team all knows it, that the American College of Surgeons Committee on Trauma has proven that people who hold very different views on firearms can and will harmoniously work together, hand in hand, to develop programs and strategies that reduce unnecessary death and suffering of our patients, our families, and our communities. It is possible to do. We have proven that it is possible to do that. So our FAST and iSave work group recommendations provides a pathway to do just that. And it is our fervent hope that legislation that incorporates our FAST and iSave groups can pass at the federal and state levels. We can save lives. We know we can do it, and we must act. If we increase cooperation and communication, work together, talk together, I know we can find a way forward. The public wants and expects us to do that. The medical community has the expertise in caring for the patients, and we know that if we bring a health and medical approach to this, to the legislative table, we can really make a difference. Thank you very much.
Thank you, Dr. Stewart. Next, I'd like to introduce Dr. Eileen Bolger. Dr. Bolger is a professor of surgery at the University of Washington. She is the acting chief of their Division of Trauma, Burns, and Critical Care. She is the chief of trauma at Harborview, and she is the medical director for the American College of Surgeons trauma programs. Dr. Bolger.
Thank you, Dr. Turner, and good morning. I've been asked to give you more detail on the FAST team recommendations. I think it's important to recognize that we've been talking about a public health approach, and a public health approach, one of the key things is engaging those that are at greatest risk for any injury in that process. So as such, we recognize the importance of engaging both firearm owners and communities at increased risk of firearm injury in developing solutions for this complex problem. Our FAST and iSafe teams were designed to do just that. The FAST team included surgeons from across the U.S., almost all of whom were passionate firearm owners and also experts in firearm safety. This group came to consensus on 13 specific recommendations that we believe are bipartisan and could have immediate impact in saving lives. Each point has an underlying principle and a specific recommendation, and these were published in the Journal of the American College of Surgeons in 2018. And I'll cover each one of them for you. The first recommendation relates to the principle that those who are a danger to themselves or others should not be allowed to purchase or receive a firearm as a gift or a transfer from another person. To accomplish this, our recommendation is to support a robust and accurate background check for all purchases and all transfers of firearms. The next principle is that firearms should be transferred with registration in accordance with federal law, just as other properties are, vehicles, homes, etc. This would include the private sale and transfer of property that is bequeathed from an estate among family members. Our recommendation is to support firearm registration and the development and implementation of an electronic database for all registered firearms. The next principle is that we currently have certain classes of weapons with significant offensive capability that are appropriately restricted and regulated under the National Firearm Act as Class 3 weapons. These include things like fully automatic machine guns, explosive devices, and short-barreled shotguns. We recommend a formal reassessment of the firearms designated within each of these National Firearm Act classifications. For instance, high-capacity, magazine-fed, semi-automatic rifles such as the AR-15 should be considered for reclassification as an NFA Class 3 firearm or assigned a new class designation with tighter regulation. We believe that licensure should also be considered for this class of weapons. The next principle relates to the requirements for safety training. The principle is that firearm ownership and use comes with significant responsibility, which requires the understanding and safe handling and care of firearms. We endorse formal firearm safety training for all new gun owners and endorse hunter safety and safe gun handling education and recommend appropriate adult supervision for all of those under the age of 18. The next principle is that owners who do not provide reasonable, safe firearm storage should be held responsible for adverse events related to the discharge of their firearms. We recommend that firearm owners be required to provide safe and controlled firearm storage, and those that do not should be held accountable for adverse events related to the discharge of their firearms. This includes the use of a stolen firearm unless it has been timely reported to law enforcement. The next principle is that for individuals who are deemed an imminent threat to themselves or others, firearm ownership should be temporarily or permanently restricted based on due process. We recommend that programs to remove firearms from individuals should be standardized, as is done in extreme risk protection order policies and red flag laws. Specific due process measures should be required for the removal and the return of firearms, and mandatory reporting to and by law enforcement and medical personnel for those that are threatening themselves or others should be standard practice. Furthermore, we recommend treating mass shootings as terrorism and support and encourage domestic law enforcement efforts and strategies to predict, detect, and deter future mass firearm violence. Next, we believe there's an opportunity to make firearm ownership safer through the use of innovative technology, such as we have done with automobile safety. We encourage the development of firearm technology that would significantly reduce the risk of self-harm, prevent unintentional discharge, and prevent unintended use by someone other than the registered firearm owner. Research to understand health conditions underpins the modern practice of medicine and is essential to improve care and develop effective interventions for all healthcare conditions. It's a cornerstone of developing an effective public health approach. As such, we recommend that research for firearm injury and firearm injury prevention be federally funded at the level commensurate with the burden of disease, without restriction, and that such research be conducted in a nonpartisan manner. The research agenda should broadly address firearm safety, including safe storage and safe use, the root causes of violence, violence intervention strategies, and improving the treatment of patients injured from firearms. We all own the culture of violence. The same principle of freedom with responsibility applies to the way mass killings are communicated to the public. We have concerns that the manner and tone in which information is released to the public may lead to copycat mass killers. Our recommendation is that the public, professionals in law enforcement, and the press should continue to take steps to eliminate the notoriety of the shooter and be mindful of the impact that their coverage has. Social isolation combined with exaggerated depictions of violence, especially when targeted towards young men, likely contribute to violence in the United States. We encourage recognition of mental health warning signs and social isolation by teachers, counselors, peers, and parents. And when these warning signs are identified, immediate referral to appropriate medical health professionals. When signs of violent ideation, thoughts, or actions become evident, peers, teachers, and family members should be encouraged to see something, say something, and report to appropriate local and national law enforcement. In addition to these fast recommendations, our iSave team has also published an overview of strategies to address the inequities which contribute to the social determinants of violence. We advocate for federal funding to support the development of hospital-based and community programs for violence intervention and prevention. We believe this comprehensive set of recommendations is a roadmap to help us reduce deaths and disability plaguing us today as a result of firearm violence. We are looking for immediate, actionable, and achievable solutions to this problem. Thank you very much.
Thank you, Dr. Bolger. Next, I'd like to introduce Dr. Patrick Bailey. Dr. Bailey is a fellowship-trained pediatric surgeon. And while any premature loss of life is horrific, when we lose the lives of innocent children to trauma, the profound impact is felt across generations. Dr. Bailey.
Thank you, Dr. Turner, and good morning. As Dr. Turner said, I'm a pediatric surgeon by training. I currently serve here in the DC office of the American College of Surgeons as a medical director. In way of my background, I'm a native Arkansan. I currently reside in Arizona. I'm a lifelong gun owner. As you've heard from Dr. Turner and Dr. Stewart, the issue of firearm violence has a profound impact on surgeons, and we are the undisputed subject matter experts in treating the tragic results. As you've heard from Dr. Bolger, the ACS has long been a thought leader in this space, working to promote an end to the firearm violence that plagues our culture and our communities. As a pediatric surgeon, I, like my other colleagues that are here today, have too often witnessed the impact of firearm violence. And obviously, the devastation extends beyond the victims to their families. To put it succinctly, in our culture, parents are not supposed to be put in a position of burying their children. The recommendations made by the ACS FAST Work Group were the result of a very deliberative process that included participation and perspective from other surgeons who, like me, are also gun owners, but gun owners who also seek to reduce the impact of firearm violence in our country. I do not believe that the steps recommended by the ACS FAST Work Group pose an undue burden on the rights of individual gun owners. As a pediatric surgeon, it is my sincerest hope that Congress will come together in a bipartisan fashion, examine the recommendations made by the ACS, and enact substantive legislation directed at mitigating firearm violence in this country. Thank you.
Thank you, Dr. Bailey. Next, I'd like to introduce Dr. Jeff Kirby. Dr. Kirby is a Brigham Family Endowed Professor and Director of the Division of Trauma at the University of Alabama at Birmingham. Dr. Kirby is also the chair of the American College of Surgeons Committee on Trauma.
Thank you, Dr. Turner. Good morning. In addition to advocating for immediate legislative action, the American College of Surgeons Committee on Trauma continues to actively work on this issue. We have research efforts underway to help understand the root causes of this public health crisis, which will provide additional evidence-based solutions to this issue. Efforts, by the way, which would be greatly facilitated by increased federal funding for firearm injury research. This fall, we will reconvene and co-host a summit, like we did in 2019, to bring together subject matter experts from across the House of Medicine. We must continue to build our collective will and work creatively to address the root causes that have led to this epidemic. I talk to trauma surgeons across the nation on a regular basis. We are all deeply disturbed by the inordinate amount of firearm injuries and death we must constantly address. My own trauma center has seen a 40% increase in the number of firearm injury just in the last two years, and these numbers continue to grow. We are in the midst of a firearm violence epidemic, and we need to act. I have to believe that as a country, we can do better. We must do better. While these mass shootings shock our consciousness, it is important to point out that more than 99% of the firearm injury deaths in the U.S. are from incidents other than mass shootings. Trauma surgeons see the short-term physical effects of these injuries and watch patients struggle with the long-term impact of these wounds. This impacts surgeons as well. We are human, and we can't help but share in the grief, the pain, and the suffering that our patients endure. While we are committed to continue our work in developing multifaceted and evidence-based solutions to this public health issue, our FAST work group has already developed a list of consensus-based initiatives ready to be put in place now. I am confident that the American College of Surgeons and our trauma surgeons will give their full measure of effort to support bipartisan solutions to address this epidemic. We have a path forward that can help turn the tide on this epidemic, and we hope that elected leaders and other healthcare professionals will join us in this journey. Thank you.
Thank you, Dr. Kirby, and thank you to all of our surgeon experts who've participated with me this morning. I would be pleased at this time to open the floor for questions. Yes.
Yeah, hi, I'm Jerry Zaremski from the Buffalo News, and I was curious about something Dr. Bolger said about reclassifying certain weapons. Is that something that would require legislative action, or could, say, the AR-15 be reclassified to executive action?
Dr. Bolger?
Yeah, I'm not sure I know the answer to that question, but we do think that that is a reasonable way to think about greater regulation around the AR-15s or that specific class of weapons that might be more achievable than some of the other things that are being proposed. So we're optimistic that that could be something that could be considered.
And in follow-up, whether it's a legislative process or an executive order, our goal is to have that change made, and we would be willing to work with any stakeholders in the service of making that change. Thank you for the question. Are there some online questions? Good. If there are no other questions, we thank you very much for your attention and for bringing this critically important issue to the fore. Thank you so much.